Good morning. This is Michelle Geiger-Bronsky. I'm the founder of the Door County Scottie Rally, and I want to encourage you to mute your phones or whatever device you are on. Welcome to the very first DCSR ZOOMIE of 2023. We have a wonderful array of topics that we're going to be presenting to you over the year. And before we get started with this particular topic, I want to encourage you all to make sure that your devices are muted. If you have questions, please type them in at the very bottom. There's a little chat area that you can type your questions into, and we will take those at the end of the presentation. The other thing I'd like all of you to do, if you could, is just type your name in below and say, hi from wherever you're from. It'll give us a chance to kind of get connected with where you are from, with your name, etc. The other thing is, this session is being recorded, so you're being on the session sort of connotes your agreement with being recorded, whether you are visually seen on the recording or we open up for dialogue a little bit later. So I just want to make sure that you're all aware of that. Before I turn things over to our board member, Lori Keenan, who is taking care of the ZOOMIES for us this year, I want to ask all of you to make sure to mark down Saturday, February 25th on your calendar to join us. We're going to be doing another Zoom meeting, but it's actually going to be the Scottish Terrier Club of America Health Trust Fund is going to be doing that Zoom meeting. So it's not going to be a Door County Scottie Rally event, but it is an important event for all of us nonetheless. And what that Zoom meeting is going to be about the Health Trust DNA Bank. And the title of that topic is going to be All Scottie DNA Matters. So stay tuned and watch for information regarding that. So I think I've covered everything. Our presentation is going to last about 45 minutes, and then we're going to allow a good 15 minutes or so for questions and answers. So without further ado, Lori, it's your gig.
Okay. I've known Erica forever. I think when I had my first,
even though we're very young.
Yeah, when we were both younger. And I'm just going to say right now, I'm not going to be I can't be anything but adoring about her. That's about it.
Thank you.
Erica has been rescuing Scotties for over 30 years, and she does it right. She's in the Northeast USA, primarily as the rescue coordinator for the Scottish Terrier Club of Greater New York. She also volunteered many years as the National Rescue Coordinator and is currently the Rescue Referral and lead trustee of the RescueTrust Fund for the Scottish Terrier Club of America. In 2022, Erica received the Antonella Visconti de Modrone Health Advocate Award from the Health Trust Fund of the Scottish Terrier Club of America for her decades of advocacy for the Scottish Terrier breed. So thank you, Erica, for all you've always done. She's not a veterinarian, but she has had two of her own Scotties who had Cushings. And by working closely with veterinarians, she was able to stabilize them and help to stabilize and place several rescue Scotties who were also diagnosed with Cushings. She has done research online and interviews in person and online to enhance her own knowledge and give a presentation on Cushing. She gave one to the Scottish Terrier Club of Greater New York, and Michelle heard about this through the Scottie grapevine. We all know how strong that is, and she said, we have got to get this. I've heard great things about this presentation. So we approached Erica, and she was very gracious and said she would update the presentation, do a little bit more research to be more current, and that's what she did. And I am just I've seen this, the PowerPoint, and I have had 3 dogs with Cushing's. And I learned a lot from this presentation. The endocrine system is very complex, and so the stuff is sometimes a little bit hard to understand. You don't have to understand everything, just absorb what you can and take away the big message, which is this can happen, and please be aware of it for your Scotties. So without ado, I'll turn it over to Erica. The title of the presentation is Hormones Going Wild, Cushing's and Your Scottie.
Okay, hi. I don't know why I got a little line down the middle of mine, but hopefully it's not blocking anybody from seeing it. I'm Erica Cerny, and I am not a vet, so I'm not trying to take the place of your vet here, but you should work in conjunction with your vet if you start seeing any of these issues come up. Not every vet, and we'll talk about this later, but not every vet has a lot of experience with it. So hopefully this presentation will make you more comfortable with all the pieces of it, even if you don't understand all of them. You can maybe take away or maybe get a copy of this presentation so that you can refer back to it if you ever have to run into it with Cushing's. Okay, so for this presentation today, we worked with Lori and Michelle to go over what kind of things we thought you might be interested in knowing about Cushing's. So we're going to just sort of follow this guideline here, this outline, and we're going to talk about what is Cushing's, overview of hormones involved in Cushing's, of the glands involved, and some definitions of Cushing's disease and Cushing's syndrome versus Cushing's syndrome. Then we're going to talk, because most of that part in the beginning, it's going to be dry. I'm sorry, I apologize, nothing I could do about it. But I tried to use some colorful slides so that you would stay awake. And once you know the definitions, then we're going to go into how is it supposed to function? How does it break down, and not what does it look like when it doesn't function? Symptoms that you can look for. The different types of malfunctions, the different types of Cushing's, which is very important really because there's several types. The testing and diagnostics so that you know what tests you're going to be doing and how to read them and how does it work. So if you suspect your dog has it, you'll know what tests will be done and how to read them. And also then the treatment and management. What treatments are there out there to manage it? And then just a little wrap up at the end. Should I treat my dog? What if I don't? And Q&A. Next slide, please, Lori. Okay, so these parts are just definitions. Try to, I know they're dry, but try to think about it and hopefully it'll make sense. Cushing's disease, also known as hypercortisolism or hyperadrenocorticism, is a chronic excess of the hormone cortisol levels in the blood caused by faulty feedback loop between the pituitary and adrenal glands. These glands are part of the endocrine system. The endocrine system is made up of glands that produce and secrete hormones that regulate the body's growth, metabolism, and sexual development and function. The important takeaway from this is cortisol hormone, I envision it as adrenaline. We all know what that feels like. So, and the reason for it is it prepares your body for stress. So if you can just understand that the hormone cortisol that does that, if it's in your body, it's being overproduced, then you fall under the Cushing's disease heading. Okay, Lori, please, next slide. This is just a diagram of the endocrine system, just to give you an idea. This is in people. the system is the same in dogs, just located in different places. Today, we're just going to focus on the top left, the hypothalamus and pituitary gland, and then on the right-hand side, the third down, the adrenal gland. All the others are in the same system, and everything is connected, but these are the ones that we're going to talk about today. So just keep in mind, the hypothalamus and pituitary gland are in the brain, and the adrenal glands are on top of each kidney. There's 2 kidneys and 2 adrenal glands. And they're in your lower abdomen, but you really think of the kidneys as sort of in the back, your lower back, that whole area. Okay, next slide, please. Okay, again, dictionary of terms here. The hormones that are involved are ACTH, just remember ACTH and cortisol. ACTH, adrenocorticotropic hormone, which is produced and released by the pituitary gland in the brain. Its function is to stimulate the production of steroids from the adrenal cortex. That's the adrenal glands. So the cortisol is a stress hormone made in the adrenal glands, which helps the body respond to physical or psychological stress. It affects a wide variety of bodily functions, including blood sugar levels, fat and protein metabolism, muscle and skeletal functions, kidney function, nervous system, cardiovascular, and immune system. So you can see it controls a lot in your body. So just remember ACTH and cortisol hormones. Next, thanks. Now you have a few glands that are involved. We're going to talk about 3, but mostly involving 2. This is the hypothalamus in the brain. It's at the top of the brain stem. It's a small part of the brain responsible for the function and homeostasis, or the balance of bodily systems. It's a big job. Body temp, thirst, hunger, mood, blood pressure, sleep, sex drive, among those. Located at the base of the brain, it produces a corticotropin releasing hormone that triggers the pituitary gland to produce the ACTH hormone. So if you just think of this as, this is the beginning part of the process. The hormones that are produced from here as response to stress, then next step is it goes to pituitary gland and tells it to produce ACTH. So next slide, please. We go right to the pituitary gland, which is like a little on the stalk of the hypothalamus, right next to it. It's a pea-sized gland located at the base of the brain, attached to the hypothalamus by a stalk. It produces ACTH hormone that signals the adrenal glands to either suppress or induce cortisol hormone production. So it knows when you've got a lot of stress, you need more cortisol. It also knows when you don't need it anymore, it signals back, and it's a feedback loop. It signals back and says, okay, don't produce anymore. My situation is done. I'm not scared anymore. And I don't need that much. And then it lowers, it starts lowering the production of ACTH hormone. So if you just can think of it as a feedback that goes back and forth, almost like if you're diabetic, your sugar goes up and then your body produces insulin to lower it. This works the same way. It goes back and forth. If you need it, it produces it. If you don't need it anymore, it stops production. Okay. Next slide, please. The adrenal glands. Now, these adrenal glands are little triangular shaped yellow things that sit on top of your kidneys. And they are broken down into, as you can see this, the adrenal cortex is the outer section. It's 3 layers. And then the inner is the medulla. The 3 layers, if you can just look at this diagram, they each are responsible for producing different hormones that are used in your body for different things, but a lot of them are involved in stress. So if the middle, if you see the middle one, it's called the zona fasciculata, that's where cortisol is produced. But if you look around and you see in the other ones, in the glomerulosa and the reticularis, there's different hormones that are being produced in there. Some of them are estrogen, testosterone, epinephrine. There's something that works with pain, aldosterone. So each section is responsible for producing a certain kind of hormone that works in the body for different functions. And you can see on the right hand, upper right, a kidney with the adrenal gland sitting on top of it. The ureter goes down to the kidney, to the bladder. So that's where it's located. There's two of them. There's one on each side above each kidney. Thanks. Here it is, just a picture in dogs. This is where it's located, where the triangle is off on the right. It's down in the lower abdomen, the lower, like back area. See the kidneys and the little adrenal glands on top. Next slide, please. Okay. The collaboration between the hypothalamus gland, the pituitary gland, and the adrenal gland is known as the HPA axis. Their joint activities control the body's stress reactions. So those three glands are involved in all stress-related changes in your body. Okay, so a few more descriptions here. Cushing's disease was first described by Harvey Cushing in 1932. He was a top brain neurosurgeon of his time, having studied and worked at the top universities in the country, Harvard and Yale, and some of the top hospitals as well. A lot of his research was done at the Yale Brain Lab in Connecticut. Cushing's disease, as initially discovered, refers to a pituitary tumor that overproduces ACTH hormone. And the reason why he described it first was because he was a brain surgeon. So Cushing's referred to an issue with the brain. And on the other hand, Cushing's syndrome, which is a little different, it was later on described as referring to overproduction of cortisol or other similar hormones originating from other locations in the body that behave just like Cushing's, such as adrenal tumors, atypical Cushing's, which you probably all heard of a lot. Many dogs have atypical Cushing's. Iatrogenic or exogenous Cushing's, which is caused by medicines, or some cancers like lung or testicular that also on the side produce hormones or can be converted into cortisol. Those things, while they look like Cushing's and they have the same symptoms, they are not officially Cushing. So that's why there's a distinction between disease and syndrome. So I just wanted to bring that to your attention here, because you might run into that later if you end up with one of the other types. Next slide. Okay. What does the HPA axis do? These three glands. In a normally functioning system, ACTH and cortisol hormones will increase due to stress and infection, pain, surgery, trauma, or cold temperatures. Anything you can think of that would cause you to have stress. These hormones prepare the body to manage stressful situations by altering normal body functions temporarily. For example, giving you extra strength, shutting down digestion, changing blood pressure, to name a few. When a stressful situation is over, they return the body back to normal balanced function. In a well-balanced system, cortisol is released into the body throughout the day, the highest levels being in the morning and the lowest levels at night. In cases where sleep is often disturbed or the dog is kept on an owner's second or third work shift schedule, this can be different. So, even with people, your day and night is thrown off if you're working late hours. And so it can work the same way with dogs that are living in houses like that. This day-night clock is also known as diurnal or circadian rhythm. You probably heard of that. It helps your body be alert in the morning and wind down at night. And we'll talk about it later. But in dogs with Cushing's, they tend to be up at night. Their schedule is all off. And this is something that bothers a lot of people. They'll say, my dog is up all night. They're up, they're walking around, they're keeping me up, they're peeing. And so it's something to be aware of. That is a symptom. Okay, next slide. Okay, how does it work? it's supposed to work this way. During times of stress, the need for cortisol is detected. The hypothalamus gland signals the pituitary gland, which produces ACTH and then signals the adrenal gland down here to produce cortisol. As the cortisol enters the cells and binds to the steroid receptors located throughout the body, it initiates changes that prepare the body to respond to stressors of different types. When the stress has been resolved, the hypothalamus detects the cortisol level and signals the pituitary that then signals the adrenals to decrease cortisol production. So it just goes in this big circle. Round and round, the net effect is that mildly fluctuating balance is achieved in a healthy dog, just as with all other hormone levels in your body, your estrogen, your testosterone. This feedback loop must be very succinctly controlled to maintain a normal balance in the body. When there's interference with the feedback mechanism between the glands, one doesn't realize that the other is telling you to stop producing, and it just continues to produce. Next slide. Okay, so what could possibly go wrong with this? Well, when the feedback loop has gone awry, it's primarily for one of these reasons: a pituitary tumor, an adrenal tumor, or interference of medications. The result is chronic excess of circulating blood cortisol, Cushing's disease, or the opposite, I guess, could happen, too little cortisol, known as Addison's disease, which is the absolute opposite of Cushing's disease. In effect, when Cushing's dog is being poisoned with too much cortisol and cannot rely on its own feedback mechanism to control blood cortisol levels, this excess cortisol will cause the body to degrade. Untreated, the prognosis is usually 18 to 24 months for a dog that's untreated. If treated and monitored, the dog will live a normal lifespan, other illnesses notwithstanding. I just want to remind you how this sort of just make it more real for you if this is all these definitions are confusing. You've all felt the feeling like you're afraid to fly, but you've got to get on a plane, and now you're walking down the jetway and you're like, oh my God, you know, or you're walking your dog at midnight, you hear footsteps behind you, or you're sound asleep and you hear noises downstairs. Your body does this. And this is what basically this whole thing is related to. And so, you know, it does not feel good. And you don't want this to be going on your body all the time. You want this to be, you need it when you need it, and then you want it to be back to normal. So in this, the feedback loop doesn't work, so you don't get that relief. And it's exhausting to the body. Okay, next slide. All right, symptoms. There are many symptoms that disruption of normal function can cause in the body. Symptoms of Cushing's disease can be vague and varied and tend to appear gradually. And once they do, they tend to cause degradation quickly. This is a progressive disease. If not treated, it will cause more and stronger symptoms over time. If it's suspected, it should be monitored. Sometimes these symptoms can be confused with other illnesses or even dismissed as old age. So if you start to notice these in your dog, it's best to start testing right away and be proactive. It's also should be noted that it's not necessary for all the symptoms to be present. It could be one, it could be any combination of the following symptoms. Next slide, please. The next two slides just give you an idea of the symptoms that you should be looking for when your dog has Cushing's. Increased water consumption, increased peeing, accidents in the house when the dog was always housebroken before, sagging middle, bloated, pot-bellied appearance, weight gain or its appearance due to fat redistribution, loss of muscle mass and shape, giving the appearance of weight loss, bony skull-like appearance of the head. The head looks different. That's one of the first things I noticed about my dogs that had it. Their heads were sort of bony and they weren't quite so pretty and filled out anymore. Exercise intolerance, lethargy, hind leg, especially weakness, not wanting to walk, not being able to jump up on furniture anymore. A lot of people notice excess panting. They'll always say, well, the dog looks like they're always hot. They're panting. symmetrically thinning hair or baldness on sides of the body, overall thinning of hair on body or baldness on the tail, looks like a rat tail. Other coat changes like dullness, dryness, loss of color, or oily hair. A lot of people notice oily hair or smell on their dog's hair. My first Cushingoid dog had a beautiful brindle coat, very bright. And she turned almost like just a gray, just a muted gray, and lost that color. Thin, wrinkled, fragile, or darkly pigmented skin. It's called hyperpigmentation. We have a picture of that that we're going to show. Easily damaged or bruised skin that heals slowly. Healing is not, is sort of slowed down in this process. Hard calcified lumps in the skin. Susceptibility to infections, especially if you have a dog that keeps getting skin infections or urinary tract infections. They have little bumps on their skin, on their back, or pimples looking things. That can be one of the symptoms. Dilute urine. You wouldn't necessarily know this, although you could probably see it if they pee on your floor. In your urinalysis tests, it shows dilute urine, low specific gravity. The water they're drinking, so much water that it's just going right through their body. It's just coming out. It's not even really yellow anymore. Diabetes, inability to control sugar, seizure disorder, slow thyroid can coexist as well. Depressed mood, sleep rhythm off. These dogs are up at night. They're sleeping all day and they're up all night. Weak bones, high blood pressure. Your vet can measure the dog's blood pressure. You just have to ask. Specific changes in blood work, specifically in the liver enzymes and electrolytes. We're going to show some examples of that. And infertility. They keep trying to breed your dog and they don't get pregnant. You know, there could be something medical wrong. And this could be one of the options. Next slide, please. This is just a quick signs of Cushing's in dogs. These are the ones that most people notice, and that's when they bring them to the doctor. Drinking more water, increased panting, increased appetite, pot-bellied appearance, urinating more, and loss of hair. The increase in appetite is marked. You would know this is not subtle. Next slide. Note the hair loss and sway back and sagging belly in this Cushingoid dog. These symptoms would have been observed much earlier and should not have been ignored. So this was going on for a while. This did not happen overnight. Next slide, please. Here is also something that did not happen overnight. Look, notice the rat tail and where you can see on the legs and the lower body where the hair is thin and is missing. This dog does not look healthy. They don't look happy. This should have not have been ignored this long either. Next slide, please. This is a pot belly. It's an exaggerated one, but it is one that you really do notice it. It's not as obvious in Scotties because they have hair underneath that hangs down. They have their furnishings. But this is what it can look like. It's just bloated looking. And the top, the back looks like it sags down. This dog on the right is missing all this hair down their jacket. And the dark spots are that hyperpigmentation I was mentioning. Often you do see that dark. A lot of light colored dogs do have polka dots, but this is extreme. And this does happen in Cushing's. Not in everybody, but it does happen. Next slide, please. An important point to remember is that Cushing's will not be cured, at least not in dogs. The goal is to manage the symptoms so the affected dog will have a more comfortable life and their health will not continue to degrade. If you catch it and you treat it, you should be able to manage it. Okay, next slide. Okay, a few more descriptions. Exogenous malfunctions, these are the different types of malfunction with feedback loop. Exogenous means outside. Malfunctions are caused by factors outside the body, such as steroid medications that are typically used to treat things such as allergies, asthma, arthritis, irritable bowel disease, and cancer. This is also referred to as iatrogenic Cushing's. If you look up either exogenous or iatrogenic, you should be able to read more on these. It's reversible if the medication is stopped, but often due to other disease, it's not possible. So if you have a dog that's on chemo for lymphoma and they're taking prednisone to reduce the reaction, any kind of allergic reactions to the chemo, you're not going to be able to just stop giving them that. So you're sort of stuck and you're going to be starting to have Cushing symptoms. Also, another one I just want to bring up, arthritis. Arthritis is something that is, or spinal issues that are often treated with steroids, and it really does help the illness. But if you're going to do it long term, you're going to start causing Cushingoid symptoms. And so we're going to talk a little bit later about how you can sort of work around that with medication doses. But, you know, you may decide that you don't want to cover all that. You don't want to suppress all that steroid because you want to keep the dog more comfortable with the arthritis. It's a balancing act. We'll talk about that later. Endogenous malfunctions are caused by factors inside the body, such as cancerous or even non-cancerous tumors or nodules on either the pituitary gland or the adrenal gland, or from excess cortisol or ACTH being produced somewhere else in the body as part of a secondary illness like the lung cancer. It produces a little extra called ectopic when it comes from someplace else. There's also a malfunction type known as atypical Cushing's or adrenal hyperplasia-like syndrome, or overproduction of other steroid hormones like sex hormones, like adrenaline, like estrogen, cause symptoms that look like Cushing's. The same symptoms, but when you do the Cushing's test, it doesn't show up as overproduction of cortisol because it really isn't. It's overproduction of, let's say, estrogen. I had a dog like that, and she had all these Cushing symptoms, and we couldn't do anything for it because there was nothing for that type. So later we'll talk about how you can maybe treat that more naturally, and that's the best you can do right now until they come up with something else. Okay, next slide, please. Okay, we're almost to the end of the definitions part. Types of Cushing's in depth. There's a few types. Pituitary dependent is really accounts for about 85% of Cushing's in dogs. It's a microscopic benign tumor usually, which oversecretes ACTH and ignores the adrenal gland's response. So it is constantly producing, and even though the adrenal gland is producing the cortisol, it doesn't recognize it, and it keeps sending out messages, produce more. So 50% of these tumors are less than 3 millimeters in diameter. They're so small you can't really see them. The dog's pituitary gland keeps cranking out the ACTH, and that's causing the adrenals to keep cranking out cortisol, and yet it does not respond to stop releasing. Dogs with, now this is like, if you look in an ultrasound, you would see this clearly. Dogs with pituitary dependent Cushing's tend to have two very large adrenal glands, as both are constantly working overtime and they're swollen. A small percentage of these growths are larger than 3 millimeters. And if they start pressing on other things in the brain, they can start causing other neurological symptoms here, like you see blindness, circling seizures, inability to walk. And those you have to treat differently because now it becomes a problem with your brain, not just this one little gland. Okay, next slide. Adrenal dependent. Only 10 to 15% of Cushing's diagnoses are adrenal gland based. Approximately 50% of those, more than with pituitary, are cancerous. 50% are benign. If they're cancerous, then you're really dealing with cancer and not with Cushing's. So anything you do to treat it, it's not gonna really help. It will eventually spread to other organs and you're just gonna be dealing with it like it's cancer. But thankfully, this is a small percentage of Cushing's tumors. In dogs with adrenal-based Cushing's, on an ultrasound, one adrenal gland tends to be extremely large due to the overpopulation or growth, and the other tends to be extremely small or atrophied because it's not really being used. That's one way you can determine it. We actually have an example of an ultrasound report that's going to show that later. Okay, next slide, please. Iatrogenic. The iatrogenic is the one we discussed earlier, which is one that's caused by medications. So this is reversible. If you're treating your dog for allergies and you're on steroids, and your dog starts drinking a ton of water and starts peeing and having accidents, when you stop giving them that, it will go back to normal. So ideally, it would be great if you could stop using that, but there are some diseases or illnesses where you can't, and then unfortunately it's going to cause that, and that's the problem. There's no tumor, it's just being caused by the medicine. So dogs with Cushing's tend to have two very small atrophied adrenal glands on ultrasound from lack of use. They don't even need to be used because the medicine is providing all the steroid and more than it needs. So here I'm just mentioning on the bottom, if it does develop, it is reversible. And you can wait. A lot of times the vet will just give you steroids and say, here, take this for a certain period of time. Some of them don't tell you even how long to take it for, just kind of goes on, let's say for allergies or irritable bowel syndrome. I would really recommend you use it as sparingly as you can because you don't want to cause these kind of problems. You know, and sometimes you don't have any choice, but I try to stay off it as much as I can. One thing I do want to mention that's on this slide is, I'm just looking to where to pick that up. If you, and we're going to talk about it in another one too. If you give somebody steroids like prednisone and you just stop it, immediately and don't wean them off it, you can put your dog into a fatal shock situation and they can die from that. So it's a very important thing to remember when you're using those things. I guess we all probably have to use them at some times, even on ourselves, but this is something that you should be aware of. And I didn't realize that's why that happened, but this is why, and we'll go over it a little bit in a minute. Next slide, please. Okay, atypical Cushing's. Sometimes similar symptoms will be displayed, and even some of the diagnostic testing will point to Cushing's, but then when you do the test, it doesn't show up, and now you're scratching your head. And often the doctor will just say, oh, well, it isn't. But it kind of is. It's just that it's a different hormone. It's not cortisol. So officially, it isn't Cushing's. But there is another test that you can do called the adrenal hormone panel, and that can tell you if it is one of those other hormones that's being overproduced that's causing this problem. And I think it's worth knowing that that's what's going on. It will often show an elevation in another adrenal hormone that's throwing off the hormone balance in the dog. Estrogen, aldosterone, testosterone can cause the same symptoms, but the treatment for these are not yet developed. The ones used for regular Cushing's will not work, and in some cases have side effects that worsen the symptoms, so should not be used. For example, we'll talk about it. Trilostane supposedly can elevate estrogen. So if you give your dog trilostane thinking that you're going to give it to them and it's going to fix the problem, you're actually making the problem worse. So natural remedies can help control the symptoms in some of those, and there are some positive studies that show in some cases even implanting patches or using vitamin supplements can lower these increased hormone levels to increase the comfort of the dog. And that's your goal, really. Okay, next. Okay. Tests used in diagnosing Cushing's. There's a handful of tests that are being used. You probably will do more than one, so just be aware. This is a complex disease syndrome to diagnose because cortisol levels in the body are continually fluctuating. In addition, just bringing a dog to the vet for hours, they're going to be a nervous wreck in many cases, and that's going to cause them stress, which causes their cortisol to be raised. So, you know, that's one of the reasons that they want to do it at the office and keep the dog quiet in there in a cage for the day. As symptoms are varied, several tests will be needed to confirm a diagnosis of Cushing's. It's best to start with the blood work or urinalysis and then do some imaging if necessary, so that confirmation you can confirm it or rule it out. You should not proceed to the next test unless there is sufficient evidence to do so. You should never treat a dog for Cushing's unless Cushing's is confirmed, just like you should never treat a cancer patient with chemo unless you've confirmed it, because it might not be that. And you could be making it worse and you could kill the dog. And another point is they should be confirmed and experiencing symptoms, as the goal is to manage the symptoms, not to cure the disease. Regardless of what shows up on paper, if your dog is not uncomfortable, then hold off. It is a progressive disease. It will get to the point where they're symptomatic most of the time, and then you can start treating. So even if your dog shows up positive for Cushing's, and we have a lot of them that do, if they're not experiencing any of those symptoms that are on those other slides, they're not drinking too much, they're not eating too much, they're not peeing, their hair isn't falling out, then just hold off. If it really gets to be active, you'll get there and you can treat then. The medications to use to treat Cushing's can be fatal if used in a dog that doesn't have it. The following diagnostic tests will give you all the pieces of the puzzle that you need to confirm a diagnosis. Next, thanks. Okay. General chemistry blood screening test. This is not a surprise. Usually you start having symptoms, the doctor wants to know. Let's do a chem screen and see what's going on. If you'll be looking for patterns, alkaline phosphatase, most Scottie people know alkaline phosphatase because that's the one that's always elevated. It's one of the non-specific liver enzymes, and it will be elevated in dogs with Cushing's in almost all cases. The reference range is low, so that any elevation in alkaline phosphatase may trigger your vet to be concerned. I've seen people, be very concerned over very low numbers, just because they're over the upper level of the reference range. But in reality, you have to be pretty high up there in order to get symptoms. You're talking about, I would say over 1,000. I have found that most Scotties over 6 years old have elevated liver enzymes, the alkaline phosphatase and the ALT, for a variety of reasons. Many are not a particular concern or treatable, but if they are high, expect to see symptoms and you should do further testing. Along with elevations in liver enzymes, you can see elevations in cholesterol, triglycerides on the blood work, as they are involved with the fat in the blood, and electrolytes because they're involved in hydration. They are also involved, so a lot of times you'll see sodium and potassium levels off range. When I look at a blood test, somebody says to me, this is my dog's blood test, what do you think? And unfortunately, I get that all the time. I see these things are elevated, these things are off. And I know that that pattern usually means we should probably test a little further for Cushing's. If none of those are off, I would really tend not to. Again, these typical patterns, you may not see all these in every dog, but this is what would trigger me to test further, along with some of the physical symptoms like excess drinking or others that were on that list. This should be step one to determine if you need to go further with specific tests for Cushing's. If so, then one of the more of the following tests will be performed, and we're also going to show examples of those. Next slide, please. Here is a typical, what they call is, you can see it on the top left there, SuperChem, a typical blood test that you would have done to just generally see what's going on in the body. And if you look at the alkaline phosphatase, you see it's 1589. And then if you look to the right, the reference range for normal is 5 to 131. So you see 1589 is quite out of limit. And that is something that definitely would trigger your vet or me to say, all right, I think we need to look to see what's causing that. It could be other things. It could be sludge in the gallbladder. It could be your teeth need to be cleaned, but it's something that needs to be looked at. And then if you go down on the bottom and you see triglycerides are also way up, the reference range of normal is 29 to 291, and this is 906. You have to say something's going on with the fat in the body, and that is something that lends itself to a Cushing's diagnosis. Next slide, please. The next test, you can or you don't have to do it, but this is where I've started often. The reason is that you can leave a dog home. You can just take your sample of urine and drop it off at the vet and let them test it for cortisol level. And it's less stress on your dog. The test has gotten a little higher, used to be like $40. Now it's getting closer to what one of the other blood tests would be. So it's up to you to decide. But the test is called the cortisol creatinine ratio test. Let me just explain to you how it works. It's a test specifically designed just for Cushing's that's run on the urine. It examines the amount of cortisol in the urine versus the normally excreted protein creatinine. The higher the ratio, the higher the cortisol level. When an animal has Cushing's disease, they produce an excessive amount of cortisol, and that spills over from the blood into the urine. And therefore, the ratio is usually increased with animals that have it. In a Cushingoid dog's urinalysis, there would also be very dilute urine, low specific gravity from drinking so much water. And you may see elevated protein levels or white blood cell count. So when you look at the urinalysis, you'll see what I mean. Since there can also be other conditions that have these same results, it could cause a false positive on the test. If the result for this test is negative, you don't need to test anymore because the negatives are more absolute. If it is positive, it doesn't mean your dog has Cushing's, but it leads you in that direction. It certainly lets you know there's too much cortisol in the system at the time this test was done. And since the urinalysis can be a less expensive and less stressful alternative to doing blood work in the vet's office, you can leave the dog at home and bring in the sample to rule it out first. That's the only reason I can see starting there. And then we've already discussed what the results mean. Next slide. This is a sample of the results of that cortisol creatinine ratio test. If you look in the middle, you see the dog had a result of 27, and it kicks out as high. And now just come down a couple of lines, you'll see urine cortisol creatinine ratio greater than or equal to 13 is consistent with, but not diagnostic for Cushing's syndrome. Patients with the elevated ratio should be further evaluated for this disorder using the ACTH stim test or the low-dose dexamethasone suppression test, which we'll go over next. So you can see this is quite out of range. This was one of my first Scottie that had Cushing's. Next slide. Okay, now we're going to go into the blood tests. There are several blood tests, a handful of them. I'll just go over them quickly, just so you'll know, because these are the ones you're likely to be doing. ACTH blood test measures circulating ACTH hormone in the body, which indicates pituitary is producing too much ACTH. It's mostly done in people. In dogs, they usually go and use the ACTH stimulation test, which is the next one. What they do is they take a blood sample, a resting sample as a baseline, and then the dog is given an injection of a synthetic ACTH. And these are the specifics of what's injected. You have a choice of 2 different types. And based on which type they use at the vet, whichever they order, 1 to 2 hours later, they will take another blood test and see how the body started handling that excess cortisol that they injected in. The Cushingoid dog will respond to the ACTH injection with greatly increased cortisol output, meaning it didn't even notice that you added more. It's still producing. So so obviously something isn't working. Note, this test is also used for if you're treating your dog with Cushing's, it's used to periodically check and make sure that they're at the right level in the right reference range. It's also used for testing for Addison's disease, which is too little cortisol. And it's also used to check how well the medication is working if you're treating a dog for Cushing's, whether you're using mitotane, Lysodren is the brand name, or trilostane, Referral is the brand name, or to diagnose iatrogenic Cushing's. Most of the time with iatrogenic, again, you're causing it by the medicines you're giving the dog, and you usually know that. So, you don't have to do this test just to test for that, but it does let you know that. It doesn't differentiate between the forms of Cushing's. So one of the other tests will have to be done afterwards. If this test comes back abnormal, you're going to then go to the low dose dexamethasone suppression test, which is next. Next slide. The low dose, let me just show you. This is an example of the results of the ACTH stim test. I'm sure anybody with dog with Cushing's or that ever suspected Cushing's has had this test done. And this is how it works. You see there's two tubes in the top. One is the resting one they take when you first bring the dog in. And then the second one is done after an hour or two after the injection to see how the body handled it. So if you see here, the post-cortisol level was 37.3. That was the result that was obtained from this dog sample. And then if you go down to a couple of lines, you see canine normal response is 5.5 to 20.0. Obviously 37.3 is way high and it's out of range. So this dog has Cushing's. And now if you look down, the rest of this is what the lab sort of spits out so that the vet can read it. And if you get a copy of the report, you can read it yourself. Also, the hyperadrenocorticism, it just shows you results greater than 20. And it says 15 to 20% of dogs that have it have normal results. And it talks about the false positives. But this is pretty much, you can assume that the dog has Cushing's if this one kicks out high like this. It also tests for iatrogenic right underneath, and then hypoadrenocorticism is Addison's disease, and then post-Lysodren, that would be after you're treating the dog. You have to test to make sure that you've given enough and not too much medicine. So this is how you would test. That's the only way you would know. So, and it's dangerous for the dog if you overtreat, and it's of no use if you undertreat. So this is a really important test to do. Okay, next test. The low dose dexamethasone suppression test, the LDDS for short. This one is the one that a lot of vets prefer to do first, and it has a 90 to 95% ability to diagnose the disease. During this test, a fasted dog has a blood sample collected as baseline, just like the last one. And then the dog is injected with a small amount of dexamethasone, a synthetic steroid. And these are the two choices here. And then you follow up by doing another blood test at 4 hours and then at 8 hours to see how the body handled it over time, if it suppressed the adrenal glands from producing more cortisol. Sounds complicated, but it really isn't. You'll see the example afterwards. A properly functioning system will perceive the presence of dexamethasone that you just injected, and it will suppress the cortisol output throughout the test. Cushingoid dogs will not suppress blood cortisol in response to the injection because their feedback mechanism is not working properly. Dogs who suppress at 4 hours and rebound at 8 usually have pituitary tumors. So that's another way that this test can determine whether it's pituitary or adrenal. The only downside of this test is that the dog will need to be at the vet's office for 8 hours and fasted overnight. So start early because you'll be picking them up when the vet closes, and they won't be eating or drinking all day. So bring them in early for that. In humans, they just send you home with the kit and you just go to sleep, and in the morning they take the test. but they can't do that with dogs. So it's a little more difficult and it's a very long test. Okay, next slide. This is the report from a low-dose dexamethasone suppression test. And if you look under results, you'll see 3 tubes were taken. The results of those 3 tubes, one was resting, 1.3, and they did the ejection. After 4 hours, it was 0.6. After 8 hours, it was 0.3. And if you look down to where the check mark is, it says an 8-hour post-cortisol concentration of less than 1.4 does not support hypergenocorticism. So this dog's was 0.3. This dog does not show Cushing's. This, I'm just using this example. This was done on one of our recent rescues, and their mommies are on the phone probably now. Are using her example results. When she came into rescue, I'm going to show you a couple of things that led us to decide to do this test. But just to show you, this test came back normal. Can we have the next slide, please? Oh, we'll come back to, okay. High dose dexamethasone suppression test. This is the last blood test. This one most vets don't run it anymore, but it does exist. And this test, combined with the results of the LDDS beforehand or the ACTH test, is used to differentiate between pituitary and adrenal forms of Cushing's. It's done the same way. The only difference is, if you look at the dosage, it's twice the dosage that's injected in as the last one. And a dog with the adrenal tumor will not suppress at all. The adrenal tumor simply doesn't care about how much you put in there. It still doesn't care. It's still going to keep producing cortisol. A dog with a pituitary tumor, though, the one in the brain, still has some limited ability to respond to this feedback, and it should respond to a higher dose of dexamethasone with suppressing cortisol level. And that's how you can tell the difference between the pituitary and the adrenal form. Approximately 15 to 20% of dogs with a pituitary will not suppress at a high dose, and that's usually because the growths are not minimal. They're larger. It's a bigger tumor, so you would need a lot more to suppress. Okay, next slide. Ultrasound. This is my go-to, and it should be yours too. Ultrasound of adrenal glands is used to actually see what the organs look like. In most Cushing's, being caused by growths, about 85% caused by a pituitary tumor. The ultrasound will not see that because that's in the brain. And most of those are small anyway, so it would be kind of hard to see it. But most of the rest are caused by an adrenal tumor, and about half of those are malignant. So you really want to look at the adrenal glands in the ultrasound. About half of those are visible on normal x-rays, which are less expensive, but that also means that you miss all the percentage that won't show up on x-ray that will show up on ultrasound, and that would help you make a diagnosis. So first, the size of the adrenal glands in relation to the published normal sizes for adrenal glands is measured. If one is larger than the other, it could indicate one is being used more. Or if it looks suspicious or calcified hard, if there's growth on it, it could indicate cancer. A high resolution ultrasound technology is much more effective than the typical ultrasound found at your small vet practice. Just to be aware, a specialist would probably have a better ultrasound. Once the adrenal glands have been evaluated, additional organs should be evaluated for supporting changes that are common in Cushingoid dogs. There are other things that happen with other organs in the body that can be viewed through the ultrasound while they're going through. And by the way, also have your vet check your Scottie's bladder while you're paying for the ultrasound, as they're more prone to bladder cancer than most other breeds. The bladder needs to be ultrasounded full to see what's in it. Well, so remember not to let them pee on the way in to the ultrasound. Okay, next slide. here is that same dog that we looked at the last result for the low dose dexamethasone suppression test that was not Cushingoid. If you look here, so on an ultrasound, they take pictures of things. There's usually 6 or 8 pictures, which you can never see once you copy it. They're just these black boxes, but the original, you can get a copy of the original from your vet, and you may be able to see it. But the important thing on ultrasound is to look at what the ultrasonographer wrote under each of the organs that they were evaluating. In this case, this is usually a 2 to 3 page report, and I'm just showing you the one that has the adrenal glands, because that's the only thing in this dog that was off. If you look under adrenal glands, it says the left adrenal gland is within normal limits. The right adrenal gland is enlarged, rounded, and hyperechoic. That's the how the sound waves bounce off, and it tells how solid it is. And then you go down a little bit, and it says assessment. Liver changes may be consistent with Cushing's, vascular hepatopathy, a couple other things. And then it says right adrenal gland mass, rule out functional Cushing's versus non-functional. So now, when I looked at this, I said, oh, all right, so do we have Cushing's, or do we have cancer, or do we just have what you call just like an incidental finding? This dog just happened to have a little growth on the adrenal gland, and it's had that growth forever, and we didn't know about it. There were no symptoms, so nobody knew to check it. It just was found. So we're not really sure, but in her case, she has no symptoms, so we're just going to monitor it. But it is really important to note that this is something that's going on with this dog, and it could down the road end up getting worse, and she could end up getting symptoms. Next slide. This is the same dog. When we first got her into rescue, we did a blood test to see if she was okay. Excuse me, went down the wrong tube. You can see the alkaline phosphatase was 1600 and the ALT 149. This is something that we felt we needed to go further and look further. So we did the low dose dex test, and it was fine. We did the ultrasound, excuse me, and it wasn't exactly perfect, but it's just giving us the idea that we have to monitor it. And these are pieces of the puzzle that you can use for each of the dogs that you're evaluating for Cushing's. In this case, we don't think she has Cushing's. Next slide. This is a rescue that came in a few weeks ago. She came in and the owner could not afford her medical care, and so had not really done any testing or treating for her. And what happened was she came in and was in foster overnight. By the morning, she was throwing up. She couldn't stand. She had to be carried into the emergency hospital. They did all kinds of tests on her, and they did an ultrasound. And what they found right away was, other than a few other things, she had enlarged adrenal glands, suspected hypoadrenocorticism or Cushing's disease. Cushing's disease and intact sexual status, she was not ever spayed, may contribute to insulin resistance and make diabetes difficult to regulate. So in this case, I feel that the fact that she had enlarged adrenal glands was from having Cushing's, and because she was not diagnosed and she was not treated, she became insulin resistant and then became diabetic, and diabetes almost killed her. She was already in ketoacidosis when we got her in. It was terrible. But as you see on the bottom, she was hospitalized for a few days. She was treated with IV fluids and insulin, and she got under control, and now she's doing well. They've implanted her with one of those little things that you just scan, and it produces a little chart of where her sugar is every 2 hours. So this is extreme, but this dog very well could have died. And I think that this was as a result of untreated Cushing's. Okay, next slide. The adrenal steroid profile, again, going back to atypical Cushing's, when it isn't cortisol, that's the thing that's too high. It can be one of these other hormones. And in some cases, adrenal tumors can produce, those other ones. If you remember back to the little triangular shaped adrenal gland and the different layers, each of those different layers was responsible for producing different hormones. And any of those hormones could also be too high or too low as well. So in this case, it's usually estrogen, aldosterone, testosterone, and it causes the same symptoms as Cushing's. But because it's not due to the cortisol production, excess cortisol production, they don't fit in the definition of Cushing's disease. And so they're called atypical Cushing's. To test for that, there's an adrenal steroid profile. It's for many years, the only place you could get it done was at the University of Tennessee School of Veterinary Medicine. Now there's some, Lori's told me there's some other places that do it as well. It can better isolate which hormone is at the abnormal levels, and there will be suggestions with the test results on some natural remedies you can do to help improve the comfort level of your dog with Cushing's. If you go, you could go now to the University of Tennessee College of Veterinary Medicine and look under their profile, and they actually have some natural ideas of how you can help treat a dog with Cushing's naturally if they have atypical Cushing's. On the next page is a sample requisition form. Lori, you can go to the next. This is just a sample requisition form from that veterinary hospital. And you can see your vet would draw some blood and then check off some of these boxes. They want to test adrenal panel, cortisol levels, estrogen, testosterone. They do some other tests there as well. They do thyroid testing and some other tests as well. But this was for many years the only place that did this adrenal panel. And it would come back and tell you what was over. I had a dog with too much estrogen being produced and was causing the same symptoms, but in fact, there wasn't really that much I could do, except I did treat her naturally. And that did help a bit. Okay, next slide. A few other tests just to be aware of. CAT scan. Computerized tomography, CT or CAT scan allows doctors to see inside your body. It uses a combination of x-rays and a computer to create pictures of your organs, bones, or other tissues. It shows more detail than an x-ray, and you can get a CAT scan on any part of your body. An MRI, most of you heard of these before, provides precise details on your body parts, especially soft tissues, and it's done with the use of magnetic fields and radio waves. Most of those are done on people that have Cushing's or suspected Cushing's. They are probably $1,800 and up, a few $1,000s for them. So in dogs, and insurance doesn't cover them. So you're probably not going to do these tests. But just be aware that you could tell if you had a brain tumor or something with your adrenal glands through these tests as well. The goal of testing is to locate the source of the problem. Each of these tests that we went over will have a different piece of information that helps in that determination. Next slide. Okay, this last section is the maintenance and treatment of Cushing's. The goals are long-term control of symptoms, reducing negative effects of excess cortisol in the body, and improving the quality of life for the dog. This can be accomplished by either surgery or medication. Okay, next slide. Surgical treatment. For pituitary Cushing's, it's unlikely pet owners will opt for brain surgery on their dog. The growths are usually very small and usually benign. A hypophysectomy procedure is commonly performed in people with Cushing's and involves surgical removal of pituitary gland. While it is available for treatment with dogs with microadenoma, tumor less than 10 millimeters in diameter, it is seldom performed by veterinary surgeons because it's a highly specialized skill. It requires specialized instruments and equipment. It also requires lifelong follow-up with steroids and thyroid hormones that replace the functions that were removed. To treat adrenal Cushing's, the entire affected adrenal gland needs to be removed in an adrenalectomy procedure, not just the adrenal tumor. Because an adrenalectomy can be very challenging, your vet may refer you to a specialist for that. Adrenalectomies are high-risk surgeries. In the beginning, when I started getting involved with Cushings and learning about it for my dogs, I didn't know any dogs that survived the adrenal surgery. So I wouldn't do it personally, but I have heard of some people since then that have done it and it worked. But you're still talking about supplementing with a hormone anyway. So you're still talking about giving medication. Okay, next. Referral. This is really, to me, the go-to. Referral, trilostane is it's actually called trilostane, but Referral is the brand name. It's a commonly used drug and preferred medical treatment for pituitary Cushing's in dogs. It works by blocking the production of an enzyme that causes the increase in cortisol, reducing its synthesis. So it's basically blocking the cortisol from damaging the tissues, the excess cortisol. It doesn't cause permanent damage to the organs. It's also reversible. So if you give too high a dosage, you can back it off. You can counteract the dose also with prednisone if you give it to them, and let's say you give them 20 milligrams and it's too high and the dog starts stumbling around, you can give them a prednisone and it will counteract it. So I feel like it's pretty safe. It doesn't, let me see, you can also split the dose across the day and the evening so the dog has better coverage throughout the 24-hour period. Fast acting and fast to leave the system, it's probably 6 to 8 hours. It must be given each day for the remainder of the dog's life, but the doses can easily be adjusted as the dog ages or changes weight. Don't think that just because your dog takes 20 milligrams and it's working now, that in 3 years, they'll still be on 20 milligrams. I've found that you do have to make adjustments. So you really should occasionally do the ACTH stim test to see where they stand. Let me see. You can see results when you start treating it within a few days or a few weeks. I found the results were pretty immediate. You will also need to watch your dog carefully for signs of too much cortisol suppression, which are lack of appetite, throwing up or diarrhea, tiredness, low energy, shakiness, especially the back legs. You don't want to give too much. You want to just give exactly what you need. So that's why the testing is helpful in determining exactly what that is. It's better to start low and inch up. It's better to start at 20 milligrams if that's determined. That's the starting range for a dog of your dog's weight. And start with 20 milligrams. And if you don't see any negative signs, then you do a test. And if it's still too low or too high, I should say, then you can increase it maybe 10 milligrams. And then maybe you increase it 10 milligrams again. You increase it in the morning or you increase it at night. And that way you take it very slowly. You can always back it off, but it's better not to start too high and make the dog sick to start with. So trilostane can control the disease, but it does not cure it. So it's given have to be given every day. Monitoring tests are more frequent earlier in treatment and then need to be done only once or twice a year afterwards. So in the beginning, you may be like, oh my God, this, like, I keep having to bring the dog in, but you want to do this like when you first start, maybe 10 days to 2 weeks after you start the treatment, and see where it falls now on the reference range. How much cortisol is your dog overproducing? Then once that is determined, you may be good and they may want to test it in 3 months and see if it's still there. If you're still adjusting the dosage, you're going to need to do it more often. Okay. Next slide, please. Trilostane was the drug of choice in Europe for over 20 years before it was approved by the FDA for use and sale in the United States. In the past, we had to order it directly from the distributor, Masters Marketing, or manufacturer Arnold in England. Few vets would write prescriptions for the medication because it wasn't FDA approval for fear of losing their license, so it was done more under the table. Now it is an FDA approved and manufactured by DECRA in the United States, packaged under the brand name Referral. It's available for use through your vet and is ordered from their suppliers, just like they order all their other medications. The generic name is Trustee. It comes in 5, 10, 30, 60, and 120 milligram capsules and can also be compounded to a specific dosage your dog needs by any compounding pharmacy. It's usually based on the weight of the dog and the severity of the symptoms. And I can't overestimate this enough or underestimate this enough. This is like, when I first started treating my first dog with Cushing's, I had to go and order it from Masters Marketing. And these boxes of Trustee would come in the mail. And I'd be like, this is gold. This is just, you know, my dog, this is going to save my dog's life. And I used to pray that the FDA didn't catch the package on the way into the United States. And you had to go through so much stuff. You had to find a vet that would write it, and that they were cocky enough to say, I don't care, this is the right thing to do. It was a whole big deal. And now it's nothing. And it came in 2 doses. It was like 30 and 60 or 30 and 120 milligrams. And you had to cut it. You had to pour this powder out and cut it. It was like, oh my God. So this, just being able to order and all these, or even have it compounded, is a huge thing. It's a huge thing. So from my experience with Trustee, my suggestions are, when your dog is going to be having surgery or some situation where they're going to be very stressful, whether it's a groomer or boarding, you're going on vacation, you're taking them on vacation and they don't like traveling, they will be stressed and they're going to use more cortisol. So if you're using and you're cutting their cortisol, you might be interfering with what they need to function properly. So during those times, I would either skip a day or cut the dosage so that they would have a little extra. In the long run, it's not going to make any difference, because every 6 or 8 hours, you need to give the dog more of it anyway. So, you know, you can just pick up where you left off. It takes a long time to get to the point where your dog is having symptoms from Cushing's without treatment. Okay, next slide. All right, a couple other things that can be used to treat Cushing's. Anapril, selegiline. This medication, I'm only telling you these because you may see this in things you read, or your vet may mention it to you. This medication is used to treat senility in dogs and works by raising dopamine levels in the brain, which has a little effect in inhibiting creation of ACTH. As a side effect of that, it lowers cortisol levels slightly. It's FDA approved to treat Cushing's in dogs, but it's only for uncomplicated pituitary type. It's safe, but it's actually pretty ineffective for Cushing's when it's full blown. And most veterinarians who are familiar with it will only waste the time. You won't waste their time with it. It's just, this is just listed here in case someone suggests it to you. I don't think I would go there. Next slide. Lysodrine, Mitotane is the brand name, is a chemo drug that works by causing a controlled destruction of adrenal gland tissue to decrease overproduction and release of cortisol. I want to explain a little bit better what that means. In the adrenal cortex, that little triangular gland that's above your kidneys, you have the 3 layers. This chemo drug destroys those layers. It destroys the adrenal cortex. And it takes time to destroy it. So when you destroy enough of it that it's not able to produce cortisol, overproduce cortisol anymore, then you've essentially addressed the overproduction issue. The problem with this is that it can grow back or it can repair itself, and now you have to start over again. And sometimes if you use it for long periods of time, it becomes ineffective. And some dogs don't respond to it at all, but it is a very dangerous thing. You obviously don't want to kill off all your adrenal cortex. So you don't want to give more than is recommended. A lot of people will give it to their dog and then they aren't even watching to see what happens. When they get to the point where it's too much burned out, they start throwing up and staggering and not eating. So you really have to stop at that exact point. The way it works is there's a loading phase where you have a higher dose of the drug given every day for 7 to 10 days. And when the right amount has been destroyed, then you stop and you give a maintenance dose, which is going to be just a smaller dose a few times a week, just to maintain that level of the adrenal being burned out. Okay, so if you burn out too much, you go the opposite way. You don't have enough cortisol. It's called Addison's disease. Many of you may have dogs that have Addison's, or know of dogs that have Addison's. They don't have enough cortisol, and that's very dangerous. They can have an Addisonian crash and die. So you really don't want to force them too far into that camp either. However, some vets and doctors, even for humans, try to do this on purpose because it's much cheaper to treat. So you need to be very careful when using this drug. That's the takeaway from this. Okay, next slide. Ketoconazole. Many of you may know this from skin issues. Ketoconazole is an antifungal medication that has a side effect of suppressing cortisol of either pituitary or adrenal origin. It's safer than Lysidren, pretty much anything is, but it's not really effective for a dog that has full-blown Cushing's. It's also very hard on the liver. So in my opinion, it's best to just use it to treat yeast and fungal infections in the skin of dogs, which it works great for. Its effects are fully reversible when stopped. It's just listed in case your vet suggests this to you or you read about it. I wouldn't go there for Cushing's. Okay. Next slide. Okay, melatonins and lignans. This is where you go if you have atypical Cushing's. Trialostane is usually not recommended because it can increase estrogen. So if your dog's issue is that they produce too much estrogen, this would obviously be making it worse. The veterinarians at University of Tennessee advise treating atypical Cushing's with melatonin, which decreases cortisol and sometimes estrogen, and lignans, a type of plant fiber compound, phytoestrogen, which may also inhibit enzymes involved in the production of estrogen. So Lysidren, that we just spoke about, can also be used in combination with melatonin and lignans to help lower sex steroids other than estrogen, along with suppressive effects on cortisol level. And that's because Lysidren, again, is burning out the adrenal cortex that also produces those other hormones. So it can work with it, but the melatonin and lignans are natural. Melatonin is a hormone that regulates the body's hormones and circadian rhythm and is used in veterinary medicine as a natural treatment for coat loss. Researchers are not sure exactly how it helps, but some dog owners have reported increased comfort levels in their dogs while using it. A lot of people take that to go to sleep at night as well. There are two types of lignans. There's the flaxseed and the Norwegian spruce lignans. They're found in high concentration of flax seeds and also found in sesame seeds, fruits, berries, whole grains, and vegetables. When I used it for my dog, I got flaxseed oil from the health food store, and then I would just add like a teaspoon to their food. Also, it's really nice on the coat, really makes their coat nice and shiny. During the digestion process, the plant lignans are converted into a form that that can affect estrogen levels, one of those being the main hormones that are involved with atypical Cushing's. Okay, one more slide. Okay, radiation therapy. It's not a treatment option to use radiation for hormone secretion of pituitary tumor. Radiation therapy can only reduce the size of the pituitary tumor. This may be beneficial if an animal is experiencing neurological signs because of the size of the pituitary tumor and it's pressing on different parts of the brain and causing other problems. However, if there's no neurological signs, the radiation therapy is not recommended because it's not effective in controlling the hormone output of the tumor. Research has shown that after radiation therapy, some dogs will see some temporary improvement in their clinical signs, but will ultimately relapse. So there's no point in doing it then. Some dogs show no improvement at all. Most dogs end up needing medical therapy, meaning trialostane or mitotane, after or Lysidren after radiation therapy. This is just listed in case your vet suggests it to you or you're thinking like, will that help? Not really. not for a regular case of it. Okay, next. Okay, what if you don't treat your dog for Cushing's disease? We've seen that when your dog has Cushing's, their adrenal glands are producing too much cortisol, more than is needed or is healthy to keep their body in balance and in good health. This is actually a serious condition and can be life-threatening. It can shorten the life of your dog. Too much cortisol weakens your dog's immune system, leaving them open to infections and other canine diseases. These complications can include damage to both body tissues and organs and change the way they function. A dog without treatment will experience more symptoms, therefore having a poorer quality and shortened life. Okay, so that should convince you that it's worth taking a look at. Okay, next slide. Okay, look at the big picture. When you're treating Cushing's, you have to look at the whole picture. There are other medical issues that could be negatively affected by your treatment. You may choose not to treat dog based on these findings, but treat the most important issues instead. For example, untreated Cushing's can cause diabetes, as I showed you in that example. So if your dog is a severe diabetic, as a result of that, you could choose to treat the diabetes and not the Cushing's. If you get the dog under control and they still have symptoms, you could consider doing both, but it isn't as easy to control when you've got multiple endocrine issues going on at the same time. As Cushing's often occurs in older dogs, your dog may be suffering at that time from arthritis or spinal problems. Arthritis and orthopedic issues are often treated with steroidal drugs, so the extra cortisol that is produced in the Cushingoid dog can actually be beneficial for your dogs in those conditions. It makes them feel better. You may decide to treat a little lighter on the medication to allow enough steroid to help the dog's pain and yet help some of the other Cushingoid symptoms like drinking too much or having accidents. It's a delicate balance, and you'll need to determine if and how much suppression you think is in the best interest of the dog, because of course the medication suppresses too much cortisol. So in dogs with Cushing's that have cancer or problems with other organs where they may not have much more time remaining, it may not be fair to them to do a lot of testing or changing a lot of medication, or some dogs may not be healthy enough to take the medications or survive surgery. Certainly that, sorry, that's why. These diabetic dogs, they were not strong enough to withstand taking any other medicine or surgery at the time. Cushing's is a progressive disease. It may take some time before your dog starts showing symptoms and can negatively impact their quality of life. You can wait until then to take into consideration everything that may be going on with them at that time. See what's going on with them when they start having symptoms, and then you can better make your decision based on the test results and this amount of symptoms and the severity, what you can live with and what they can live with. Okay, next slide. In the end, the bottom line is that most Cushing's is treatable and manageable and can improve or restore quality of life when treated, maintained, and monitored properly, giving them a normal lifespan. My Cushingoid dogs all live till 14. Don't let the diagnosis scare you. Don't ignore the symptoms. Don't let your vet scare you. No offense if there's any vets on the line. There are some vets that actually have told some of my people that have come to me that they talk them out of it because it's a big deal. Oh my God, you're not gonna be able to handle this. Don't let them talk you out of that. It really isn't. When you look at it and you maybe read through this a few times, you realize that, you know, it does make sense and you can do it and it can help your dog. Don't ignore the symptoms. Now that you know how this all works, you should be better able to understand and communicate better with your vet. If you understand how this works and you know all the parts, you know the names of the tests and what to be looking for, your vet's going to be happy because they don't have to go through this with someone who doesn't understand. It's complicated, and I'm sorry. It was complicated for me to explain it to you, and it's complicated for them to explain it to you as well. If your vet says, oh, gee, I don't know that much about this, I really haven't had any Cushingoid dogs, go to another vet that has, because you don't want them testing and you don't want this being trial and error on your dog. There's a lot that do treat this all the time. For your dog's health is your responsibility. That's what you signed on for when you bought them or adopted them. Take care of them. Give them a good life. Give them the best life you can. Your dog's health, is so important. Please don't let them suffer needlessly and die from Cushing's related problems. I often get people contact me in rescue and say, my dog died from Cushing's. And I think, do I want to give them another dog? They could have tested, they could have treated. Their dog didn't have to die from Cushing's. If you feel, I saw somebody sent a chat thing through that said, we can't all afford these tests and all this medicine and that kind of thing. I understand, not everybody can. But if you cannot afford the testing or the medication or don't know which vet to go to, please contact us or contact me or contact other Scottie people and investigate your options. You might really be surprised at all the help you get. You really might. For further information support, look on the internet for all of the topics we discussed, and you can read a little bit more in depth on each of them. I think we pretty much covered a summary of everything that's involved, but you can certainly go. There's a lot of information out there because this affects humans and dogs and cats. Next slide. I hope this will be helpful for you if you ever need it. Hopefully you won't, but please feel free to contact me if you have any questions. Here's my contact information. And I appreciate your attending, and hopefully you're still awake and, understood some of it. I know it was it's complicated, and it's something that you're not used to hearing about. But it is really important to understand it. Scotties have Cushing's often, and there are these different types. So you need to know, do you have the one that's easier to treat? Do you have the one that's harder to treat? Do you have the one that's more likely cancer? How can I tell if it's cancer? It will help you to have this information. Even though you don't know, you may not have one right now that has Cushing's. You don't know that at 10 years old, they won't get Cushing's. And you also don't know if the next dog you get in will have Cushing's. I adopt dogs, and I take them into my rescue program, and we work on them and try to determine what's wrong with them. But I also adopt dogs that are older. And a lot of times they come in with Cushing's. So I need to be ready to test and to treat and figure out what's going on. So somebody just brought up, Colleen, that Scotty's Rock Foundation, you may be aware of that. Scotty's Rock and Scotty's Rock Foundation does a wonderful job of fundraising and funding individuals that have Scotties that have high medical expenses. They also do have a lot of very experienced people on their board and as members, and you can contact them. Certainly a lot of people and a lot of clubs and a lot of organizations might be out there to assist you, but that's a good place to start if you're an owner. If you're a rescuer and you're looking to try to get the dogs straightened out and it's expensive to go through all this stuff, the STCA Rescue Trust Fund will help with those bills. So you just have to apply. You can contact me about that too, because I do that. Anyway, I apologize for the dryness of the topic, and I hope that I picked enough information and examples to do justice for you. Lori, how are we, or Michelle, how are we going to figure out what questions to answer? Is somebody just read them, or should I be looking at the chat?
No, you don't need to look at it. Michelle and I will go through,
Okay.
and we have lots and lots of people thanking you, and this was a phenomenal presentation.
Thanks.
So
I'm happy I didn't totally choke through the whole presentation, but I don't know if there's a way to make a copy of the presentation available to people. I don't want it to be where you guys are doing all this stuff, but if I can do it, please let me know. I can certainly email a written presentation like this out, or if they like the PowerPoint presentation, if they have PowerPoint, I can email them that deck, or
it will also be available online on our YouTube channel.
Okay, good.
the recording, but if people, we can, that Erica's contact information is there, and we can between us decide how exactly, if people want to get the written version or the actual PowerPoint, how we'll handle that. But you can just get in touch with Erica directly right now, and between us,
please
we'll
feel
decide
free.
on that.
Yep. Please,
So
please
I
feel
can-
free. You can always look
I
under
can-
Scottish Terrier Club of Greater New York Rescue and find my contact information there. Sorry, Michelle.
That's okay. If I can interject, the other thing is this not only will be on our YouTube channel, but it is going to be accessible at DoorCountyScottieRally.com, which is our website, and it should be loaded up by tomorrow evening. So that's going to be the easiest way to find it and get the direct link to go to this presentation. So the entire thing will be viewable, as our other Zoomies that we've been able to record are also going to be available on our website as well. They are right. I'm sure by tomorrow evening, our fantastic new person that's helping us with social media and revamping our website will take care of that for us. There is one other question, and actually before we get to that other question, Erica, I just want to say bravo. You knocked this out of the park. This is
Oh,
not an easy
great.
topic to cover, and you did phenomenally. And we had 41 attendees, just so you know.
Great.
And
I'm
they
glad.
stayed.
Yeah,
Everybody
yeah.
stayed.
Everybody's still awake.
Yeah. One
is a
question.
question that-
Exercise now. Yeah.
There is a question that came in that it's from Joanne Marsh. What's the youngest age you know of in terms of a Scottie developing Cushings?
8.
8?
8. Yeah.
I had
It doesn't mean that it can't happen, because
Correct.
remember, it's gonna be mostly caused by either medication, or it can be caused by, a tumor in the pituitary in the brain or in the adrenal. You can have a growth just like you can have a mole that's not cancerous, but it's still interfering. So it could grow at any time. It could be 6 years old, but typically it's something that happens in older age. You're still typically talking, like when we get in dogs in rescue, they're 10, 11, 12, 14, they come in and they have these kind of things. So, but my first one was at 8, and they didn't want to, they didn't think it could be Cushing's because they thought it was too young. And she had that full blown. You saw that those results were hers that were in the beginning that were very high. And I had her on trilostane from the beginning, and she lived till 14. And she died of liver cancer. But, she would have kept living if it was just for the Cushing's, and she had a very nice life.
Yeah.
I had a
Thank you.
question, Erica. Are Scotties more prone than other breeds to developing Cushing's? And if so, do we know why?
Well, I'm probably not the best person to answer that question. I'm just going to give you my opinion. It seems like a lot of them do get it. And that's why I think it was really great for you and Michelle to decide to, present this to people who have Scotties, because you're probably going to run into it with one of your dogs. But I do know a lot of other dogs, a lot of other breeds have it as well. And I think, as with most things, there's probably some genetic component and some environmental component that triggers that genetic predisposition, I would think. It could just be something that happens with age, like your blood sugar goes up, or you become insulin resistant as you get older. A lot of times, it just sort of doesn't mean you have to have it in your family to have it happen. But it seems like a lot of Scotties I know have had it older. I used to go, oh my God, I hope I don't get a Scottie into my rescue program that has Cushing's. Now it doesn't bother me at all. Doesn't bother me at all. I know what I can do to fix it. It's much better than having cancer and not having all the options that you might have with this. So
We're getting a lot of mentions in chat that people have had dogs with Cushing's and have been able to manage it very effectively. And that's, I
Good.
think that's a really big takeaway from your presentation too. There is hope. It's not the most horrible thing in the world.
It isn't the most horrible thing. Most things you can do something about. You can at least prolong their life with it. In this case, you can prolong their life for their whole lifespan if you do it right. And
I've had 2 dogs with atypical and have had good results from using melatonin and flax lignans. And both of those dogs lived till 13. One, I think, was probably 14. He was a rescue too. Most of my dogs are rescues. But I think there is some, even though this is kind of, it's not as reliable perhaps as trilostane if you don't have atypical Cushings. In my experience, it has given big relief from symptoms and also a full lifespan.
Yeah, and they may yet come up with other things. They may come up with something like trilostane that works for estrogen or that works for testosterone or aldosterone. And so, a lot of these big pharma decisions are governed by how much money they'll get back for it. So if they don't think there's enough dogs that have that problem, they won't look into it. But I think actually there are. I've also had dogs with atypical Cushing's, and I'll bet you a bunch of you out there too do. And you may not even know it.
There's another question. Nan says, recently my vet said, don't test if you are not going to treat. Don't treat if there are no symptoms. Do you agree?
Personally, I don't agree, because I think information is always helpful to have. If I would like to know if my dog has Cushing's, I would like to know that's the reason for these symptoms, because the dog could be drinking or peeing too much because their kidneys are going. And then I'd have to maybe monitor their diet or give them phosphorus binders or things like that. I would like to know what's going on. If I don't have to treat, great. Eventually I might have to. So at least I'll be looking for the symptoms, but I won't be looking for them if I don't know the dog is testing positive for it.
What if there are no symptoms?
If there are no symptoms and the dog tests positive for it, you don't treat them until they have symptoms.
But you would test
I still want to know.
Even if there are no symptoms, you would test.
No.
Okay.
You would be really, you have to have something. I'm not
Okay.
saying to all of you, go out and test and spend all this money on these tests. I'm saying if your dog has a couple of those symptoms, multiples of those symptoms on the symptom lists, there were 2 pages of symptom lists, or you are starting to think something is going wrong. Your dog is drinking bowls of water. They're laying down by the bowl of water. Some of them won't even leave the bowl. And they're peeing, they're having accidents in the house. They're leaking on the couch. They're peeing in their sleep because they're drinking so much. It's coming out so dilute. Then, I would say something's going on. Do a blood test. If you see the blood test, some of those things are very elevated, lets you think something's going on. Then do one of those other tests. Do the urine test for it, or do the low dose DEX test, do the ACTH stim test. See if your dog tests positive for it. If they do, then I would say, you could just keep it in mind if they don't have more symptoms than you're comfortable with. But if there's a dog drinking so much water, they're drinking more than 4 bowls, Scottie-sized dog, drinking 4 bowls or more of water a day, that dog's uncomfortably thirsty. And they've got to be peeing somewhere. You're going to be taking that dog out in the middle of the night. You're going to be taking that dog out twice as much as you did before. It's not going to be good. They're not going to be feeling good. There's going to be other things going on. So, you have to have some reason to test for it, some indication.
And again, I just want to reiterate the issue in terms of the cost. Many times decisions are made because we're worried about the cost.
Right.
I can't agree I can't agree more than the fact that Scottie Sprach Foundation fills an incredible niche for all of us. And so I want to encourage you to take advantage of that as a major resource. And then Colleen Rafferty, who is a board member or previous board member, I can never remember if she's on or off the board right now, of Scotty's Rock, is also on this call. And she did a post that said, don't despair immediately. I had a Scottie diagnosed at age 4 with atypical Cushings, who lived a great life until 12 plus years of age. Her litter brother developed TCC at age 10, subsequently developed full-blown Cushings and calcinosis cutis due to the steroids initially used. But with good vet management, that was all controlled, and he lived another 2 years with quality of life until cancer claimed him. And that is exactly the reason why we wanted Erica to do this presentation, because you know, vets are busy, they're stressed beyond belief these days because there's not enough help. And so the more informed we can be to go in and ask those questions and pinpoint exactly what your reasoning is, the more you and your dog are going to get the best care possible.
Right. I wanted to
Somebody
say
asked for the address for Door County Scottie Rally, and I've typed it into the chat. You can also find this under the contact tab at doorcountyscottierally.com. And if you are inclined and have the resources and could help us by supporting, giving a donation to support our continuing presentation of these invaluable programs and putting them up on the web so that people who couldn't attend can still see them, that would be very much appreciated. And there are ways to donate on the website too. So thank you all for that. I just want to reiterate how important this particular subject matter is, and to thank Erica for doing a fabulous presentation for us. We have another comment that someone had an atypical Scottie girl who lived to 17, and that's just, you know, that
That's
tells you that
wonderful.
there is help. That's phenomenal for a dog, a Scottie of any sort. So that's I once had one that lived to 17 too, and it's a real treasure. So, and yes,
if you do
there
have
is help.
somebody, yeah, I mean, like she said, don't despair immediately. And, you know, if you feel that, you know, you'd like to talk to somebody about it, who knows what, you know, contact me, or you know, or one of people here, and discuss it. Because sometimes people call and they're just crying. They think that means their dog is going to be dead. And, you know, it could be. But if you follow through with this, it probably won't be, if that's the thing that's the problem. And we can at least, you know, try to be there to handhold you through the process. And a lot of people actually over the years have called me about, you know, oh, my doctor said the dog might have Cushings. I'm terrified. I haven't got any money. What am I going to do? You know, like, we'll figure it out. All together, the Scottie community will figure it out. And it doesn't hurt to ask. So it is something that's really important not to ignore.
Well, we are at almost 2 hours right now.
Oh, I'm
So
sorry. All my
No, that's okay.
presentations always go over.
I
Yeah,
don't see any new questions that have arisen. So
Okay.
I'm going to bring us to a close. Thank you to all of you for joining us this morning, and huge thank you to Erica. And I will be posting on Facebook once the presentation is available on website as well. Okay.
Maybe print it out and keep it in your folder, your file cabinet or something, in case you ever have to run into it. But you can always contact us. So
Thank you again, Erica.
Yes, thank you again, Erica. And we also do have, in addition to the Health Trust Fund Zoomie that Michelle mentioned at the beginning, we have another Zoomie coming up in March, on March 18th, with animal communicator Lynn Schuster, which should be another fabulous presentation. So.
And, you know, please do think about supporting Door County Scottie Rally with some donations. They do a great job of making sure that the public understands the issues that pertain to Scottie Health. And they also support Scottie Rescue. They donate to us every year to help us keep doing what we do. So it's really important to all of us in Scottie Rescue that, you know, that they're there also, and that they help us succeed. So we're all in this together.
Absolutely.
Okay.
Have a wonderful day, everyone. Thanks again. Thank you,
Thanks.
Erica.
Thanks,
Thank
everyone,
you.
for attending.
Great.
Thanks.
Bye-bye.
Thank you.